If you're scoring around 70% on practice exams, but you are not sure if you should book your CPHQ exams, you are in the most dangerous stage because this is the stage that most people either take the exams too early and they fail, or they overstudy months after months and they waste too much time. And both are avoidable. So in this video, I'm going to show you exactly how to know if you are ready to take these exams based on real signals and not guesswork. Let's dive into it. If we haven't met before, my name is Peter, and I've spent over a decade in healthcare quality, working on HEDIS, working on STARS, quality improvement, and clinical operations. I've worked on programs reviewing thousands of charts annually, gap closure initiatives. And I can tell you that when it comes to the CPHQ exams, most people don't struggle because they are not capable. They struggle because they are using wrong study approach. And I'm going to help you fix that. Let's get one thing straight here. Being ready for the CPHQ exam does not mean that you've read everything. It doesn't mean that you've memorized every definition. And it certainly doesn't mean you are 100% confident. That is not real. As a matter of fact, real readiness means you can think like a quality professional. Ask yourself, when I see a CPHQ question, am I recalling information or am I actually thinking through the problem? That answer matters a lot. Let me make this real. Let's say your health plan's A1C measure rates is dropping in Q4, and your leadership and stakeholders are pushing hard on this measure. What do you do first as a clinical quality professional? If your mind goes to which chapter was this in, then you are not ready, my friend. But if your mind goes to what data are missing, is this a documentation issue or a gap in care? Do we need outreach or provider intervention? Then you are now thinking correctly. Let me test you real quick here. There's a question. So the provider group has low colorectal cancer screening rates. What is the first thing you should do as a quality improvement professional? A, launch a campaign or launch a member outreach campaign. B, educate providers immediately. C, analyze the data to identify the root cause. If you chose C, then you are thinking correctly, because in quality improvement, we analyze the data first, because you don't act first. You need to understand the root cause, and then you implement your solution and you measure. So if that made immediate sense to you, then I think that is a good sign. But if not, then this is where you probably have a gap and you should pay attention to. Now, I'm going to give you 5 real reasons that you are ready to take this exam. The number one sign is you understand concepts and not just terms or terminologies. You don't need to recognize PDSA or root cause analysis or benchmarking. You should understand when to use them and why they matter. For example, anyone can say PDSA cycle, but if I ask you, when would you use PDSA versus implementing a full-scale intervention? Can you answer that clearly? If your answer is yes, then you are very close. But if not, then you're still memorizing stuff. The number 2 signal is you eliminate wrong answers first. This is a big one. You don't need to know the right answer instantly. As a matter of fact, there are going to be a number of questions that may have similar correct answers. So you don't need to know the right answer instantly, but you should be able to say that is not best practice or that does not follow quality framework. For example, if an answer says implement changes immediately without reviewing data, as a quality professional, you should instantly reject that answer because, like I said before, quality work is structured, data driven, and very intentional. If you can eliminate 2 to 3 answers quickly, you are thinking correctly. The number 3 signal that you are ready to take this exam is your scores are consistent. Let me be very clear with you. If you are scoring 80% once in a blue moon, that means nothing. I mean, when I was preparing to take these exams, I would get excited when I scored 80 or 90, but that doesn't indicate progress. What matters is consistency. If your scores looks like 55, 80, 60, 75, you are not ready. What did I say? Say to yourself, I'm now ready if this is your situation. You want to have stable performance around 70 to 80% or even higher consistently because the exams will test reliability, not luck. Um, the fourth sign that you're ready is you can explain concepts very simply. This is underrated, but if you can explain something simply, then I think you understand it if you agree with me. For instance, root cause analysis, and I'm going to explain this in a very simple term. In root cause analysis, we are not trying to fix the symptom. We are trying to find the problem that keeps happening. So if you can explain concepts like that, you are ready. The fifth sign that you're ready to take these exams is you are not overthinking everything. If every question makes you feel like, wait, maybe it is this or maybe it is that, there's uncertainty, you are not ready. Ready candidates read, they interpret, and they decide, not perfectly, but confidently. You don't need to be perfect at this, but you must be able to approach this with confidence. On the contrary, signs that you are not ready to take these exams, let me be honest, you are not ready to take these exams if you are still trying to memorize everything, or if you rely heavily on notes during practice um, exams or mock exams, or you don't understand why an answer is correct, or you panic when questions are worded differently. The exams will not ask questions the same way the study materials will do. So if that throws you off, then you are not ready. If you feel like I'm almost there, here is what you should do. Stop passive studying. Focus on practice questions, and you need to understand the why answers are correct. Also, make sure that you're fixing your weak areas aggressively. Don't keep consuming new content if you haven't mastered what you already studied. Then it's not progress and it makes no difference. You are going to be overwhelmed. That is also not strategic studying. That is how people stay stuck month after month, siphoning information and study materials, and they end up caught up in a loop. Now, let me leave you with this. You don't need to be perfect in order to take the CPHQ exams. Let me leave you with this. After taking these exams, I tell you confidently that you don't need to be perfect to pass these exams. However, you should also making sure that you are doing your due diligence to study. You need to be very clear, very consistent, and also strategic. And if you can think through scenarios and eliminate bad answers and stay consistent, then you are going to be ready or you are ready. Now, if you're tired of guessing what to study and just want a very clear, structured path to passing these exams, I've built a CPHQ prep system specifically for busy professionals who don't have the time to waste. And you can check that out in the link below. Now, if you're serious about passing and not just, studying endlessly, comment "I am ready" in the comment section. And that is how I know who I'm building this for. And if this video helped you, make sure you subscribe, like, share with somebody who is interested in taking the CPHQ exams, because I am breaking this entire process down step by step. And again, I'm in no way affiliated with the NAHQ organization. This is just research gathering based on public information and based on my own experience and information I have found as at April 2026. I will see you in the next video.